Good morning, students. Today I'll be starting about the biphasic liquid dosage forms known as emulsions. As you know that the biphasic liquids are of suspensions and emulsions. An emulsion is a biphasic liquid preparations containing two immiscible liquids, one of which is dispersed as a minute globules into the other. The liquid which is converted into minute globules is called as the dispersed phase, and the liquid in which the globules are dispersed is called as a continuous phase. So as you know that the biphasic liquids, that is the emulsions, you have oil and water. So because of this difference in densities, you can see that the oil will tend to float on the surface of the water. So, but whatever it is, the oil has to be put into the bulk of the liquid, that is known as the continuous phase in form of a minute globules. So these oil globules are broken down into the smaller size, and hence they are put into the continuous phase by a third substance known as an emulsifying agent. So the emulsifying agent, what it does is that it will coat the globules entirely and forms a film over the minute globules, and so that these globules will be dispersed in the continuous phase and remain as a separate entities. So that is the reason that the emulsion is forming a stable preparation because of this emulsifying agent, what it is being coated with the globules, what is coating the globules. So the globule size in emulsion varies from 0.25 to 25 micrometer in diameter. Emulsions having large globules are called as coarse emulsions, while those having globules of mean diameter below 5 micrometer are considered to be fine emulsions. The emulsions having globules of smaller diameter as for 10 nanometer are known as microemulsions. These emulsions are milky and transparent. So the emulsions are very much unstable preparations, it is called as, because they are thermodynamically unstable, because if an emulsifying agent which is protecting the globules, if it is been destroyed or broken over the surface of the globules, then there will be separation of the two phases, that is known as the oily phase and the aqueous phase. So this oily phase and aqueous phase, when it is separated, this is because of the difference in densities, and therefore the oil will be separated and it is being forming a layer on the surface of the water. So that is the reason a stable emulsion can be prepared only by selecting a suitable emulsifying agent and coating the globules with a suitable emulsifying agent, whereby these globules will be dispersed in the continuous phase. So the whiteness of the emulsions. So you can see that the emulsions, when it is being prepared, it will form a milky white preparations. So the whiteness of the fine emulsions is due to the reflection and refraction at many interfaces. If two phases have same refractive index, a transparent emulsion is formed. So if you see these emulsions, you have the various types of emulsions, what is being prepared for cosmetics, for pharmaceuticals, and for parental preparations, and various types of emulsions. You can see that it has been prepared. It may be of oil by water or water by oil type of emulsions. So now if you see the advantages of emulsions, what are the advantages? Medicines which are having unpleasant taste and odor can be made more palatable for oral administration in form of an emulsion like castor oil emulsion and cod liver oil emulsion. So this cod liver oil emulsion and castor oil emulsion is one of the best examples. Apart from this, the liquid paraffin emulsion, which is also one of the best example for the preparation of the emulsion. And therefore, you can see that most of the oils, when it is being used in the formulation of emulsions, it has been seen that the oils has to be protected with the emulsifying agent when it is being dispersed in the continuous phase. So the next advantage is that emulsions provides protection against drugs which are prone to oxidation and hydrolysis. So various external preparations such as creams, lotions, foam aerosols are formulated in form of emulsions. The sterile stable intravenous emulsions containing fats, carbohydrates, and vitamins can be administered to the patients who are unable to take them orally. So this is some of the advantages. So further, if you see the advantages, that is the unpalatable oil soluble drugs can be administered in the palatable form. So some of the drugs which are oil soluble and some drugs which cannot be taken orally, or they can be seen that these drugs which are only solubilized in the oil, and like the vitamins and hormones, these type of drugs which are solubilized only in the oil, which it can be administered in form of the emulsions. So possible of include two incompatible ingredients, one in each phase of the emulsion. So if there are two incompatible ingredients which it has to be administered, one can be put in the oil phase, one can be put in the continuous phase. So it can be given in form of an emulsion. They can mask the bitter taste and odor of drugs, making them more palatable. And for example, castor oil and cod liver oil. As you know that the castor oil and cod liver oil, it is not acceptable if it is taken orally. If it is seen that the cod liver oil, once if it is been placed on the tongue, it has to be seen that the people will tend to have a nauseating effect. So this cod liver oil, which can be converted into a form of emulsions, which can be flavored and it can be given orally. So this is one of the advantages. So they can also be used for prolonged release of drug providing sustained action. So prolonged release of drug means over a period of time, the drug is being released and it is can be given in form of emulsions. So next advantage is that carbohydrates, fats, vitamins can be emulsified and it can be administered to the bedridden patients as a sterile intravenous emulsions. So some people are bedridden, especially the geriatric patients and patients who are having severe diseases who are bedridden, where these food materials like carbohydrates, fats and vitamins, which can be emulsified and it can be given in form of emulsions and it can be given in form of an intravenous route. So emulsions provide protection to drugs which are susceptible to oxidation and hydrolysis. So emulsions provide protection to drugs which are susceptible to oxidation and hydrolysis. This is one of the greatest advantage in emulsions, where the drugs which can tend to undergo the oxidation or hydrolysis in presence of water or in presence of atmospheric oxygen. So in this case, the drugs can be prepared in form of emulsions, which is a biphasic liquids, and it can be made to be seen that these drugs can be protected in by the oxidation and hydrolysis, which is one of the advantage. So used to formulate externally used products, for example, lotions, creams, liniments, etc. So nowadays you can see that most of the cosmetic lotions, creams, liniments are prepared in form of emulsions. So this is because they can be applied easily on the surface of the skin, and also they can be easily removed by washing with water from the surface of the skin. So that is the reason now you can see many of the lotions, creams and liniments are prepared by using the emulsion based technology. So next is that advantage is that since the emulsions which is having aqueous phase, as I told you that the emulsions are having the oily phase and the aqueous phase. So these type of emulsions are called as oil water emulsions, or if it is water by oil emulsions, these type of emulsions are called water by oil emulsions. But whatever it is, since there is a aqueous phase which is being present in the emulsions in case of oil by water emulsions, so this aqueous phase can be easily flavored and various types of flavors can be used and the emulsion can be prepared and it can be given to the patients, which can be made more acceptable. So the rate of drug absorption is increased. So the rate of drug absorption is increased because of the presence of the drug particles in form of an emulsion, and whereby this emulsion, if you see that if it is to be administered orally, fixed oils can be used for formulating the emulsions, and these fixed oils can be easily absorb the drug, and then it can show the better activity of the drug when if it is been formulated in form of emulsions. So now you have seen the various advantages of emulsions. So you're going to see the disadvantages of emulsions. So every preparation or every preparation of the pharmaceutical substances will have its own advantages and disadvantages. So now if you see emulsions needs to be shaken well before use. As you know that it is a biphasic liquid, and you can see that the oil is dispersed in water or water is being dispersed in oil in form of minute globules, and hence these emulsions, when it is been packed in the container, a patient should shake the bottle before he is measuring the dose and is administering into the body. So a measuring device is needed for administration of emulsion. So as you know that the syrups and the other medications which are of liquid orals, nowadays they give a measuring cup. The measuring cup will measure around 2.55 to 10 ml, which the emulsion has to be put accordingly to the dose what is being mentioned by the prescriber in a measuring cup, and he should administer to the oral route by using a measuring device. An accuracy is needed to measure a dose. A degree of technical accuracy is needed to measure a dose. Means accuracy of dose has to be removed out from the container. So as you know that the emulsions are viscous in nature, so there may be chances of inaccurate measurement of the dose. So that is the reason that the accuracy of the dose has to be measured by using a measuring device, and it has to be seen that the dose what is being mentioned should be taken in accordance with what the prescriber has prescribed. So if you see the storage conditions means you can see that, as I told you, that the emulsions are thermodynamically unstable. These emulsions, they are thermodynamically unstable preparations because they may crack if there is a microbial contamination, if slightly a temperature is increased, or if any change in the pH of emulsion, which can also leads to the cracking of the emulsion. So that is the reason that the storage of emulsions and the temperature of this storage condition should be appropriate in order to have an emulsion which will maintain its stability throughout its shelf life. So the next disadvantage is that they are bulky, difficult to transport, and prone to container breakages. So as you know that the liquids are packed either in the glass bottles or plastic bottles, or it may be packed in the vials or ampoules. So in case of the emulsions, you can see that if it is in parenteral administration emulsion, it can be packed in vials or ampoules, or if it is in a large volume which it has to be taken through the oral route, it can be packed in the glass containers. So these glass containers are very difficult to handle. They are very difficult during the packaging, and they are very difficult during the transport, and they are also difficult during the storage conditions. So that is the reason it is very bulky, and care should be taken that the breakages will not take place during the transport and storage of these containers. And the last disadvantage is that they are prone to microbial contamination, which can lead to the cracking of emulsions. So this advantage is seen because of the presence of the emulsifying agent. They are prone to the microbial contamination, means this is one of the greatest disadvantage what is being seen in the emulsions, because you know that the emulsions are made up of the emulsifying agents. The emulsifying agents may be of either the synthetic emulsifying agent, semi-synthetic, or natural emulsifying agent, which this has to be used in order to protect the dispersed globules in order to have a stable emulsion. If a natural emulsifying agents are used like acacia and tragacan, this leads to the breaking of emulsion, and therefore the emulsion is said to be unstable because of the type of the emulsifying agent what is being used, and it is being prone to attack with the microbial contamination. So this is the advantages and disadvantages of emulsions, and also the definition of the emulsions. So when we go to the next part, that is the classification of emulsions. So classification of emulsions, if you see, the emulsions, as you know, it is been classified into first classification. Before this, I want to tell you that it can be classified into according to the different types of emulsions, that is known as oil by water, water by oil, and multiple emulsions, micro emulsions, and nano emulsions. So this is the emulsions which is being based on the classification of the different types. Like you have the oil by water or water by oil. You have multiple emulsions. Multiple emulsions means oil, water, and oil, or water, oil, and oil, water are known as multiple emulsions. You have micro emulsions, you have fine emulsions, you have nano emulsions. All this is nothing but it is the variation of the size in the dispersed globules. So it is being classified according to that, such as the micro, nano, or fine emulsions. So now if you see the classification of emulsions based on the preparation and based on the emulsifying agents, what is being used, the emulsions can be classified as the emulsions containing natural gums. As I told you that there are natural emulsifying agents which are present. So the emulsions can be prepared by using the natural emulsifying agents. Like emulsions containing natural gums, you have gum, acacia, tragacanth, mucilage, or Irish moss. Or you can also use the egg yolk, but it is rarely used in the formulation of the emulsions. But the commonly used natural substances or natural gums as an emulsifying agent, which is used in the preparation of emulsions, is gum acacia, tragacanth, mucilage of Irish moss, or egg yolk. So next, emulsions containing a gum substitute, example, a cellulose and its derivative and salts of alginic acid. Cellulose means you know that the cellulose is obtained from the original source. So it is known as cellulose derivatives or cellulose substances, which is used as the emulsifying agent in the formulation of emulsions. Emulsions containing various soaps. So emulsions can be prepared by using the soaps, saponins, starch, and also emulsions containing natural waxes also. So these waxes can also be used as an emulsifying agent, like you have wool fat and beeswax. So emulsifying agents which contain synthetic waxes like emulsifying wax, cetomacrogol, emulsifying waxes are the synthetic waxes which can be used as an emulsifying agent. So emulsifying agents like pectin, as I told you, egg yolk, gelatin, and lecithins are also being used as an emulsifying agent in order to prepare the stable, thermodynamically stable emulsions. So these are the classification what is being given according to the type of emulsifying agent what is being used. So now if you see the next classification, the classification is based on the type of administration of emulsions. So emulsions for oral administration. Emulsions for oral administration, they are usually oil by water type of emulsions and are used to administer oils having medicinal value. Example, castor oil emulsion you have, olive oil emulsion, almond oil emulsion, cod liver oil emulsion, and liquid paraffin emulsion. So these are the different types of emulsions which can be administered orally, which these oils have a minute quantity of medicinal substances or medicinal active substances in it. So next is emulsions for external use. These may be either oil by water type or water by oil type. However, oil by water type of emulsions are preferred over water by oil type of emulsions, which is been seen that most of the lotions, creams, and liniments are emulsion based, which it is being prepared by oil by water type of emulsions because they can be applied easily onto the surface of the skin and they can be seen that it can be easily removed from the surface of the skin by washing with water. So the emulsions for parenteral use, I told you that the emulsions are administered even in parenteral route also. Here you can see most of the vitamins are insoluble in water. So there are fat soluble vitamins like A, D, E, and oil soluble sex hormones because their absorption is in this form is very rapid. So you have some of the hormones, you have some of the vitamins like A, D, E, which are fat soluble vitamins. You have some of the hormones which are soluble in oil and they can be formulated in form of emulsions and it can be given easily by the parenteral route. And these emulsions, when it is being given by the parenteral route, they have to be seen that it has to be given by the intramuscular route, and therefore the injection should be administered slowly by the intramuscular route because the administration of the oils in form of injection may be painful and hence the injections which are
the emulsions which are injected through the parental route has to be administered slowly and only by intramuscular route. So next, if you have the next classification, you can see that is what is the next classification? Emulsions for rectal use. So these are used in the form of enema for evacuation of bowel. Starch mucilage is generally used in the preparation of enema. So emulsions for rectal use, it is to be seen that the emulsions are administered to the rectal route, and this rectal route is useful in order to evacuate the bowel from the lower part of the intestine. So usually the starch mucilage is generally used in the preparation of the emulsions. So this is the classification. What is the first classification I told? The first classification is based on the type of the emulsions. Either it may be oil by water, water by oil, multiple emulsions, micro emulsions, and nano emulsions. The second one is based on the usage of the emulsifying agent. It is been classified. The third is based on the administration, that is known as the parental route of administration of emulsions. The next is based on the rectal use. So this is the various classification, various types of classification of emulsions. And now if you see the formulation of emulsions, so you can see that the emulsions, you have to see that the emulsifying agents has to be selected for the formulation of emulsions. A emulsifying agent reduces the interfacial tension between the two phases, that is the oily phase and the aqueous phase. As I told you that the emulsions are biphasic liquids in which it contains the oil or water or oil. So for example, if we take an oil by water emulsion, you can see that the oil is floating on the surface of water. This is because of the difference in densities between the oil and water. Therefore, there is a interfacial tension which is being existed between the oily phase and the aqueous phase. So in order to put this oil into the aqueous phase, you need to break this oil into a small globules, and you have to use a third substances known as an emulsifying agent, and this emulsifying agent will protect the oily globules and it keeps the oily globules dispersed in the aqueous phase and forming a stable emulsion. So that is the reason that you should see that a stable emulsifying agent has to be selected into the formulation of emulgent, and these emulsifying agents are also known as emulgents or emulsifiers. There are large number of emulsifying agents which are available to prepare a stable emulsion, but it is very difficult to select a proper emulsifying agent for the development of stable emulsion. No single emulsifying agent possesses all the properties required for the preparation of stable emulsion. Therefore, sometimes it becomes necessary to use two or more or combination of emulsifying agents in order to prepare the stable emulsion. So here you can see that the Griffin was one of the scientists who has invented the HLB scale. So HLB scale, that is, Griffin devised a useful method for calculating the balanced mixtures of emulsifying agent to provide a particular type of emulsion. It is called as hydrophilic lipophilic balance or HLB scale or HLB method in order to determine the balanced mixtures of emulsifying agents to be used for the preparation of the stable emulsion. Every emulsifying agent is given a number on HLB scale, which is divided into 18 units. Emulgents with high numbers like 8 to 18 indicates the hydrophilic properties, and it produces an oil by water type of emulsions. Emulgents with lower numbers, that is 3 to 6, represents the lipophilic properties and produces water by oil type of emulsions. So the HLB scale determines the HLB value, that is the hydrophilic and lipophilic balance of the emulsifying agent, but it does not express you to use the concentration of the emulsifying agent. It determines whether the emulsifying agent, what is being used, can be prepared the oil by water type of emulsion or water by oil type of emulsion. So that is the reason that the Griffin has invented a HLB scale, which this scale is known as hydrophilic and lipophilic balance, or HLB scale, or HLB method, to determine the emulsifying agent to provide a particular type of emulsion. This is called as an HLB scale. So here you can see that acacia. So here you can see the emulsifying agent in this tabular column, the HLB value, and what is the application. So what type of an emulsion can be formed by using this type of emulsifying agent, which it has been described with the HLB value, and it is being seen that a type of emulsion can be prepared by using this emulsifying agent. So for example, if I see here in this table, there is an acacia. So the HLB value is 8. So it is an emulsifying agent which can be used for preparing the oil by water emulsion. So as you know, here I have shown you that the HLB scale, which is divided into 18 units. So if an emulsifying agent is having an HLB value from 8 to 18, it indicates that this emulsifying agent is having a hydrophilic properties, and it can be used for preparing the oil by water type of emulsion. So if the emulsions which is having a low number or low HLB value, that is 3 to 6, then it is being seen that it is having a lipophilic properties, and it can produce the water by oil type of emulsion. So here in this tabular column, acacia is having the HLB value 8. So it is being shown that it can form an oil by water emulsion. So like this, you have the glyceryl monostearate. The HLB value is 3 to 8. So what is this 3 to 8? It can form a water by oil emulsion. So you have like this different types of HLB values, and you can see that there is a different properties of this emulsifying agent which can be formed as an emulsion by using this type of emulsifying agents. So now if you see the classification of emulsifying agents. So here emulsifying agents, as I told you that the emulsifying agents are the third substances which are added into the emulsions, and these are also called as emulgents or emulsifiers. So these emulsifying agents which protect the dispersed globules in the continuous phase in order to form a stable emulsions. So if you see the emulsifying agents, they are classified into natural substances which is being obtained from natural source, the emulsions which emulsifying agents which are obtained from semi-synthetic source, synthetic source, inorganic source, and alcohols. So this classification of emulsifying agent is very important, and it will be asked in the examination for 10 marks. Along with this, you have to explain the different types of emulsifying agent and what is its use. So if you see a natural emulsifying agent, you have a natural emulsifying agent which is being classified into a vegetable source and animal source. So if you see the natural emulsifying, the vegetable source, it is being seen that the acacia, tragacanth, agar, pectin, starch, and Irish moss are some of the naturally occurring emulsifying agents. So as I told you that when you use these naturally emulsifying agents, so these natural emulsifying agents are very much prone to the microbial contamination, and also there is a chances of breaking of emulsions. So, but whatever it is, a mixture of the combination of emulsifying agents with synthetic, semi-synthetic, inorganic, or synthetic emulsifying agents has to be used. So now if you see a natural emulsifying agent which is been obtained from the animal source, you have the wool fat, egg yolk, and gelatin. So semi-synthetic emulsifying agent. So as I told you, a cellulose is a naturally obtained substances which a chemical substances is substituted with the natural substances which you get a semi-synthetic emulsifying agent. So you can see that methyl cellulose, sodium carboxymethyl cellulose are the semi-synthetic emulsifying agents. So synthetic emulsifying agent, you have anionic, cationic, and non-ionic synthetic emulsifying agents. So inorganic emulsifying agents, you have milk of magnesia, magnesium oxide, magnesium trisilicate, and bentonite are the some of the inorganic materials which are obtained in order to protect the dispersed globules in the emulsions. But however, these inorganic materials are not widely used, but the widely used emulsifying agents are the natural, semi-synthetic, and synthetic emulsifying agents. So you also have the alcohols like carboxyls, cholesterol, and lecithins are some of the emulsifying agents which are used, and this is a broad classification of the emulsifying agents what is being used in order to formulate a stable emulsion. So an ideal emulsifying agent, what it should possess. So suppose you are using an emulsifying agent. So what are the ideal characters of this emulsifying agent? So it should be capable of reducing the interfacial tension between the two immiscible liquids. As you know that the oil and water. So because of the difference in densities, the oil will tend to float on the surface of the water. So that is the reason there is an interfacial tension which has been existing between the water and oily phase. So this interfacial tension has to be reduced. So it can be reduced only by addition of the emulsifying agents. So now if you break these oil globules into a small globules and you add a third substances known as an emulsifying agent, then these emulsifying agent will protect the oily globules and it will said to be dispersed in the continuous phase, and therefore it leads to the stable emulsions when the emulsifying agent is being used. So the emulsifying agent should be compatible with the ingredients of the preparation. So it should not interact with the drug materials, or it should not interact with the other materials like excipients or flavors what it is been added into the formulation of emulsions. For example, oral emulsions, you are using flavors. For example, external emulsions, you are using perfumes. So these emulsifying agents should not interact with the perfumes, colors, flavors, or any other excipients what is being added in the preparation. The emulsifying agent should be non-toxic. It should be capable of producing and maintaining the required consistency of emulsion. So as you know that when these emulsifying agents are added, it increases the viscosity of the preparation. So the viscosity should be maintained in such a way that the emulsion should be easily poured out from the container, or the patient should take this emulsion into a measuring device easily and he should consume it. Or if it is an external emulsion, it should be easily pourable onto the surface of the skin and it should be rubbed to the entire surface of the skin, and hence the viscosity has to be maintained in order to have a consistency, proper consistency of an emulsion. It should be chemically stable and it should be capable of keeping globules of a dispersion liquid distributed indefinitely throughout the dispersion medium. So the globules, what is said to be present in the emulsion, that is known as the dispersed globules. The dispersed globules should be kept in a separate entities. So therefore, if it is kept in a separate entities, then you can see that the viscosity is maintained and the drug is being dispersed uniformly in the entire medium, and therefore the accurate dose is being ensured when a patient takes this medication. So this is about the introduction of the emulsion, its classification, and the classification of the emulsifying agent, and also the HLB value and what is the importance of HLB value and the ideal characteristics of the emulsifying agent. So I will continue the classification and the detailed explanation of the emulsifying agent in the next class, so that until then, so please keep this emulsion as an assignment and submit it once when the college reopens. And this is a very, very important topic for your final examination as well as for the sessional examination. So today, that is the date. What is the date today? It is 10/2/2022. So today, whatever the topic I have covered on online, it should be written as an assignment and it should be submitted when the college reopens. So thank you very much, students. So I will continue the class in the next SUTIX class about the classification of emulsifying agent. Thank you very much.